Hi, Mr. Willie. How are you doing?
Fine.
Okay. My name is Rosie Hutchins. I'm one of the students at Alcorn State University, and I'm in the nurse practitioner program there. Okay. And I'm coming in to take care of you today. What brings you in, first of all?
A checkup.
Okay, so you're just in for a regular checkup?
Yes.
Okay. So what we're going to do for your checkup, I'm going to ask you a series of questions first, and then we'll get into your assessment part, okay? And the things that I will be assessing on you today will be your cardiovascular and peripheral vascular system, okay? And then we'll do your abdominal system, okay? So tell me, have you been having any illnesses recently or even at the present time?
No.
Okay. Have you had any childhood diseases such as chicken pox, measles, mumps, anything like that?
No.
Okay. What about any other medical history, any high blood pressure, or anything else that's going on?
No.
Okay. What about, now I'm going to ask you about your family history, your mother, father, sister, brothers, you know. Have any of them had any illnesses, any high blood pressure, diabetes, cardiovascular diseases, anything like that?
High blood pressure.
Okay, who has high blood pressure?
My mother.
Okay, and what, is she the only one that has anything?
Yes.
Okay. Now, have you had any surgeries?
No.
Okay, what about any serious injuries or anything?
No.
Okay. Now I'm going to ask you a little bit about your personal issues. Have you been having any problems with any type of depression or anything?
No.
Any stress-related issues?
No.
Okay. Do you smoke cigarettes or use any kind of tobacco products?
Yes.
Okay. What kind of products are you using?
No cigarettes.
Okay. How many packs of cigarettes would you say you smoke a day?
Not even half.
Okay, so not even half a pack a day. Okay. And what about alcohol? Do you drink any alcohol?
Yes.
Okay. What about street drugs? Any street drugs?
Marijuana, not anymore.
Okay, so you used to smoke marijuana. Okay, and you stopped, so very good for you. Okay, and you said you don't have any stressful issues. How's your appetite, your eating habits?
It's good.
Okay. Do you exercise?
No.
Okay. We're gonna try to get some exercise going so you can help stay healthy and keep that heart up to par. Okay. All right. So we're gonna go ahead and get started. And first of all, do you have any questions or anything for me? First of all.
No.
Okay. No concerns. Okay. I'm gonna go ahead and I'm gonna wash my hands. Okay. And we'll get started. Okay. I'm gonna unbutton your jacket, and then I'm gonna lay it down so I can see your chest and everything. Okay. So I'm gonna start off just getting this where we can see it, and I pull it down, and you can just kind of leave it down here. Okay. All right. We're gonna start up at the top, and I'm gonna start off by looking at your face, and we're doing the cardiovascular and peripheral vascular system, and just making sure there are no signs, symptoms, or anything that's abnormal. Okay. Next thing I'm gonna do, I'm gonna look at your conjunctiva, and we're looking in there to make sure that there are no paleness, no signs of anemia, which is not. And I'm looking at your mouth as well, your lips and the corners of your mouth to see if there are any cracks or anything. And I'm making sure there's no paleness, that lets us know as well if there's any cyanosis or anything, that any kind of anemia going on. Okay. The next thing I'm gonna do, I'm gonna get a pen light, and I'm gonna look inside your mouth. And when I look inside of your mouth, I'm just checking it also to see if there's any kind of bacteria or any kind of anemia, any infections, anything else going on in there. Okay. And also I'm gonna have you stick out your tongue and check for dehydration as well. Okay. So open your mouth for me. I'm just checking your mucous membranes, and that looks good. Stick your tongue out for me. Okay. That looks good as well. Okay. Next thing I'm gonna do, I'm just looking at your chest, and when I look at your chest, I'm just checking for any heaves or lifts. Okay, and there's nothing there. Okay, now I'm gonna have you to lay back on the table for me. Okay. I'm just gonna pull this down a little bit more, so just so we can see. Make sure we can see good. Okay, and also again there, I'm just inspecting, making sure that there are no issues or anything going on. I'm gonna get down at eye level and just look again for any heaves or lifts, and everything looks fine. Okay. Next we're gonna start off. I'm gonna check your capillary refill. This lets us know as well about your oxygenation. Okay. And also I'm kind of just looking for clubbing, making sure that there's no clubbing going on there as well, okay? All right. Now I'm going to come up and I'm going to check your carotid arteries, and I'm going to do this one at a time, just to make sure that I don't occlude it. Okay. Okay, and that's good. Now the next thing that I'm going to do, I'm going to palpate over the different areas of the heart, and we're going to start off with the aortic, which is at the second intercostal space. Okay. Going to do the pulmonic, which is at the second intercostal space on the left. Okay. And then we're coming down to the tricuspid. And we're doing the mitral, in which the tricuspid is fourth and fifth, and the mitral is at the fifth intercostal. Okay. And also I'm going to check for your the apex, which is at the fifth intercostal as well. Okay, and anytime that you can't feel the apex, technique that you can use that can help with that is, if you can't feel it, then you can have the patient to roll over to their left side with your hand still there. And when they roll over, what that does is bring the apex to the closer to the wall, the chest wall, and that way it help you be able to feel it easier like that. Okay. Now the next thing I'm gonna do, I'm going to check your other arteries. I'm going to check your radial. And when we're checking the arteries, we're checking for rate, rhythm, and density. And that's good. We're going to check the brachial. Okay, those are good. I'm going to get you to bend your knees just a little bit for me. Okay, just a little bit. And we're going to check the popliteal. I'm going to move your gown back just a little bit so we can see, okay? Check the popliteal. Okay. We're going to check that on both. Okay. Then we're going to check our dorsal pedius. Okay. And then we're going to check our posterior tibialis. Okay, all of those feel good. You can stretch your legs back out for me if you would like. And then I'm going to put your gown down. Okay, next, after we've palpated, then we're going to auscultate. And I'm going to listen to the same areas that I just felt, okay? And we're going to start with your carotid artery, okay? And when listening to the carotid artery, we're going to listen with the bell of the stethoscope, because it helps us to pick up those low-pitched sounds. Okay? And also, I'm going to do it one at a time. Okay, next I'm going to go ahead and listen to the aortic. We're going to listen to the aortic, pulmonic, the tricuspid, and the mitral. And I'm going to listen first with the diaphragm of the stethoscope. That was the aortic I just did. This is the pulmonic. Then we're going to listen to the tricuspid. Then we're going to listen to the mitral. And also we're going to listen to the Erb's point, which is at the third intercostal. The third intercostal space. Okay. Now, we've done that part, and I'm going to go ahead and have, I'm going to also check at this time for CV8 tenderness. I'm going to have you sit up for me. Okay. And I'm going to do that by placing my hands down here. You're going to feel me tap. Just let me know if there's any tenderness or anything, okay? Any tenderness? Any tenderness there? Okay. All right. So that's all we're going to do for the cardiovascular and peripheral system. Next, we're going to check your abdomen, okay? All right, so you can lay back again for me. Okay. And we're going to start off, as always, by inspection first, and we're looking for any striations, any lesions or scars, and we don't have any. Also, you want to check for the shape of the abdomen, making sure that there are no distensions or anything, and checking for any pulsation, because pulsation could be indicative of a aortic aneurysm. Okay? So, and when it comes to assessing the abdomen, first we're gonna auscultate. We inspect first, then we're gonna auscultate, and then we're gonna percuss, and followed by light, then deep palpation. So we're gonna auscultate in all 4 quadrants, starting with the right lower. And when you're auscultating, you want to listen for 30 seconds to 2 minutes, okay? And when we're listening there, we're listening to make sure that to see if it's normal, if the vowel sounds are normal, if they're hyperactive or hypoactive. Now, if they're or if they're absent, and if there's anything that make you think that they are absent, then you want to listen for a full 5 minutes before coming to that conclusion to make sure it's not that they're really sluggish. Okay, so we're gonna listen. Okay. And also the other thing we're going to listen to are the aortic. We're going to listen to the aortic arteries, the renal arteries, and the iliac arteries. And one more thing that I'm going to do when we get finished is on the chest. One thing that I did forget to do was to listen to the areas of the chest with the bell of the stethoscope. So I'm going to go ahead and do that now, okay? And then we'll come back and listen there. So I'm going to listen with the bell of the stethoscope to the aortic, pulmonic, tricuspid, and also the mitral. Okay, and now I'm going to go ahead and listen to the aortic of the back to the abdominal part that we were on with the regular. Okay, and we're going to come down to the renal arteries, and I'm going to listen to that on both sides. And then we're going to come down to the iliac. Okay, and also when inspection on the abdomen, when we're looking for the lesions and everything, you also want to just look at the umbilicus and make sure that it is midline, and make sure that there are no, you're making sure, checking for, see if it's inverted or if there's any protrusion or any pulsation or anything there as well. Okay, and everything looks good, making sure, checking for piercings and stuff. Okay. Now, the next thing that we're gonna do, we're gonna go ahead and do our percussion. And again, I'm gonna start off over here at the right lower quadrant, and I'm gonna percuss in every quadrant. And you want to hear the timpani sound and resonance or resonance. It's timpani. And when you hear the timpani sound, that lets you know that you're over air-filled organs. When you hear the dull sound, that lets you know that you are over solid organs. Okay. And now what I'm gonna do is check for the liver span. Also, when you are tapping when you're over in the right upper quadrant, you're also checking for your the dullness of so you can feel for the liver. Here, listen for the liver. I'm sorry for that dullness, and also for the gallbladder. And one more thing that I left off, when you over on the left side as well, the sound you're also listening for is the gastric bubble, which that's the sound that you hear right there. Okay. Okay. And next we'll go ahead and we'll start off with our go ahead and measure that liver span. And when you're measuring the liver span, you want to be in the mid-clavicular area at the umbilicus. And what you're going to do, we're going to start percussing up. And when we hear the dullness, the first part, we're going to mark there for the bottom border. And then we're going to start from the top at the lung area and go down. And then listen from resonance to that dull area. And we're going to mark that and measure it. And you want it to be anywhere from 6 to 12 centimeters. So we're going to go from mid-clavicular at the umbilicus. And we're going to go up. We're here in the tympani. And when you hear that dullness, that lets you know that you're in that area, okay? So I'm going to get an ink pen. I'm going to have to mark on you, okay? I'm going to go back and find that again so we can make sure those measurements are accurate. Okay, right there. Okay. And then we're going to do the same thing from the top. I'm going to measure right, mark it right there, okay? Now, I'm going to get my ruler, if I can pick it up, and we're going to measure this in centimeters. And like I say, you want it to be anywhere from 1 to 6 centimeters, and which his is at 7 centimeters, so that is good. Okay. All right. Now the next thing we're gonna do, we're gonna start the percussion, and we'll leave the percussion for last, so because we don't want to start the bowel sounds and have them hyperactive. So now we're gonna do percussion, and we're gonna start from light, and then we're gonna do palpation. We're gonna start from light palpation and then go to deep palpation. Okay. All right. So we're gonna start at the right lower again. Let me know if there's any tenderness there. Any tenderness? No. Okay. And you're doing that in each quadrant and noting any tenderness. Any tenderness? Mm-hmm. Okay. Okay. And everything feels fine. So after we do the light palpation, then we're going to go into the deep palpation. So I'm going to do a little deeper this time, okay? And let me know if there's any tenderness in any of these areas. And again, I'm starting on the right lower quadrant. I'm going to the left. Any tenderness? No. Okay. What about there? No. Okay. What about there? Mm-hmm. Okay. Okay, in which everything does feel good there. And now we're going to palpate for the liver, okay? And what I'm going to do, I'm going to put my hand up under your back. And then I'm going to push upward with my hand. And as I push upward, I'm going to you're going to feel under the edge of the ribs around between 11th and 12th. And you should be able to feel the liver like that. So I'm going to put my hand up under you. And then I'm going to just relax for me. Then I'm going to push up. And I want you to take a deep breath for me. It probably kind of hurts a little bit. Okay, and you can feel the liver, and the liver does feel good. And you're making sure that there are no enlargements or anything going on with the liver. And making sure that everything is where, it's fine and where it needs to be. Okay? Do you have any questions for me?
No, ma'am.
Okay. So that completes our physical exam, our wellness checkup or whatever. And everything looked good and everything was fine. So if you have any questions, let us know, okay? And again, thank you for coming to see us, of all people choosing us to come and visit with, okay?
Okay.
All right. Thank you.